If you've been Googling public health careers, I already know what you found: 100 job titles and zero clarity. So today, I'm not going to give you a list of job titles. I'm going to give you a map, the way public health teams are actually built. Because public health is not single career lane. It's an entire ecosystem made up of government, programs, data, consulting, academia, and yes, entrepreneurship. So by the end of this video, you will know which lane fits your strength, what it typically pays, and the skill stack that raises your ceiling. Quick check. Are you more a people, systems, or a data person? Comment people, systems, or data. Now here's the biggest thing most people miss. Organizations don't hire passion alone, they hire functions. They hire someone to run a program, someone to analyze data, someone to enforce regulations, someone to advise leadership, someone to teach, and someone to build. So instead of memorizing job titles, I'm going to walk you through 9 career lanes. And 1, save this truth before we start. In public health, pay and influence often increases when you're closer to budgets, scarcity skills, executive decisions, scalable funding, and higher stakes accountability. Also, quick credibility note. Whenever I mention pay, I am using the US Bureau of Labor Statistics national wage medians as anchor for the closest related occupational categories. Exact pay varies by location, sector, seniority, and role. So use the current Bureau of Labor Statistics tables for the exact numbers in your area. All right, so lane 1. Lane 1 is government, policy, and public administration. You see, this is where public health becomes laws, budgets, and population scale decisions. If you want authority, public accountability, and system-wide impact, this is your lane. The reality check is that people love the title Public Health Director, but that title isn't a single standardized national job category everywhere. Different jurisdictions structure it differently. So when we talk salary, we anchor to the closest BLS leadership categories that often overlap with this kind of work, then adjust for your jurisdiction, scope, and seniority. Day by day, senior leaders deal with budgets, staffing, crisis response, compliance, community priorities, and policy realities. The biggest mistake people make in lane 1 is thinking it's only policy. It's also management, operations, and communications, often under pressure. Lane 2 is health administration and operations leadership. Lane 1 is policy and public authority. Lane 2 is operations and performance. This is keeping systems running, staffing, quality, compliance, budgets, execution. This lane can have one of the higher pay ceilings in the ecosystem because you're close to operational scale and higher stakes accountability. A common wage anchor here is a category that covers medical and health services management roles. Use it as a national reference point, then adjust for your setting. If you like systems, leadership, and accountability, this lane is powerful. Quick self-check. If you enjoy fixing bottlenecks, running meetings, and turning chaos into process, lane 2 is probably for you. Lane 3 is programs design, implementation, and evaluation. This is where public health stops being theory and becomes execution. Programs are maternal health, HIV prevention, vaccination campaigns, chronic diseases, mental health, health equity, etc. Your day-to-day is partners, budgets, timelines, hiring, delivery, and reporting. Here's the difference. Average program managers describe activities, but elite program managers describe outcomes. Not a coordinated outreach, but we increased uptake, we improved retention, we reduced missed appointments. The salary truth here is that program roles span government, hospital, nonprofit, universities, and global health, so pay ranges widely. So the accurate way to say it, expect a wide range. Your pay is given by the budget size, the sector, complexity, and accountability. The biggest mistake in lane 3 is that people stay stuck in task. The moment you can measure outcomes and explain impact, your value jumps. And keep watching, because lane 3 becomes a launch pad when you add one specific skill stack I'll name in the data lane. Lane 4 is where we have data, epidemiology, and analytics, right? If you like evidence, this is your lane. Epidemiology includes surveillance, outbreak investigations, trend analysis, and recommendations. But modern public health doesn't reward I can analyze data. It rewards I can turn messy data into decisions. For salary anchors, epidemiologists and statisticians are two common BALS categories people reference, especially when the work is surveillance, analytics, biostatistics, or advanced quantitative analysis. Here's the key. Data roles often have a split economy. Government and academia can be stable, but pay is often moderated by funding structures and pay bands. In the private sector, for example, like pharma, biotech, insurance, tech, pay can be more for the same skill because they are scarce and tied to measurable value. If you want a higher ceiling, build a data skill stack, SQL, R, or Python, dashboards, and the ability to explain results like a decision maker. The biggest mistake in Lane 4 is treating communication like it's an extra skill. If you can't translate analysis into a decision, you won't get picked for the bigger roles. Lane 5 is environmental and regulatory health. This lane is structural risk: air, water, food safety, sanitation, housing, and workplaces. Depending on the employer, titles and job categories can vary. Some roles sit under environmental science, some under inspection and compliance, some under public safety or health department. But the work is consistent: inspection, hazard assessment, enforcement, and prevention. It's also one of the most tangible lanes because you can point to a hazard and say, we reduced that risk. The biggest mistake in Lane 5, thinking is only inspection. The high leverage version is risk reduction, finding repeatable fixes that prevent the next hazard. Lane 6 is community health, education, and outreach. This lane is built on trust. Health educators build programs and support behavior change. Community health workers bridge the system and the person: navigation, outreach, advocacy, support. Wage anchors here often come from categories like health education specialists and community health workers, but exact pay varies widely by employer, funding, and region. Yes, early salaries here can be lower than consulting and advanced analytics, but the impact is enormous, and upward mobility is real when you stack skills. Here's a quick scenario. If you're a person who can walk into a community, build trust fast, and still run a program with metrics, your ceiling is higher than you think. The biggest mistake in Lane 6 is staying only in delivery. Add program management, evaluation, or policy, and you become someone who can scale that works. Lane 7 is clinical public health. This is where licensure meets population level prevention. So public health nurses and other licensed clinicians support vaccination programs, screening, prevention initiatives, and public-facing health response. Clinical credibility matters here. In mixed teams, licensed professionals are often trusted across disciplines, and that can accelerate leadership opportunities. For pay anchors, people often reference wage data for registered nurses and related clinical categories, whilst recognizing public health specific roles vary by employer and region. The biggest mistake in Lane 7, assuming clinical work can't scale. Prevention programs, protocols, and population strategies are exactly how clinical credibility becomes public health impact. Lane 8 is consulting and advisory. This is one of the most misunderstood lanes, yet one of the most influential. Consultants help governments, donors, and organizations make decisions: strategy, program designs, evaluation, cost analysis, implementation plans. Consulting rewards clear thinking, speed, and communication. If you can't explain your thinking to leadership, your technical skill won't travel. For a national wage anchor, people often reference broad categories like management analyst because consulting titles vary widely across firms and sectors. The biggest mistake in lane 8 is thinking is just slides. The real job is decision making under uncertainty that is fast, clear, and defensible. Lane 9 is academia, research, and teaching. Public health is also a knowledge discipline. Academic careers include teaching, research, publishing, grant writing, mentoring, and training the next generation. Teaching is not a side role. Teaching is one of the highest leveraged forms of public health impact because it scales through people. Pay varies widely by institution type, discipline, rank, and funding. So salary anchors here often use broad teaching categories as a starting reference. Then you adjust for your specific context. The biggest mistake in lane 9 is underestimating the business side of academia. Grants, publishing strategy, and collaboration often drive opportunity. Now, entrepreneurship and innovation. So let's talk about entrepreneurship in public health. Entrepreneurship is not only about starting a company. In public health, it's building scalable solutions to public health problems. This can be a health tech tool, a prevention delivery model, a social enterprise, an NGO built like a venture, or a consulting firm that becomes a product. Entrepreneurship isn't a lane that replaces the others. It's a multiplier you apply to them. Program people build scalable interventions. Data people build platforms and tools. Clinicians build new delivery models. Policy people build innovative systems. Income early can be unstable. Upside later can be uncapped. The real value is scale, impact, and influence beyond the job title. Now here's the salary truth. In public health, salary and influence are driven less by your degree and more by where you sit in the system. Your pay often rises when you are close to budgets, scarce skills, executive decisions, revenue or scalable funding, or high stakes accountability. That's why consulting, advanced analytics, and executive operations pay more. That's why community roles can have lower ceilings early on, but can accelerate fast when you stack evaluation, management, and leadership. So the question isn't what job can I get? The question is which lane fits my strength and what skill stack raises my ceiling. Here's how to choose your lane in 20 seconds. If you want authority and population level decisions, go government and administration. If you want execution and building real interventions, programs and evaluation is your lane. If you want evidence and analytical problem solving, epidemiology and data is your lane. If you want real world hazard prevention, environmental and regulatory is your lane. If you want trust building and direct impact, community and education is your lane. If you want license credibility plus prevention, clinical public health is your lane. If you want fast learning curves and executive communication, consulting is your lane. If you want to generate knowledge and teach, academia is your lane. And if you want to scale solutions, entrepreneurship is your multiplier. Now you have the map most people never get. Comment your lane, write lane 4 or consulting or academia and tell me your background in one line. And if you want the next video to be the most practical one on the internet, I'll make it. The exact entry-level job titles to search for each lane, plus portfolio examples that get interviews. Thanks for watching and welcome to Public Health.